Thank you, Cabinet Secretary. Regarding the issue of continued services, indeed, we have communicated to the counties to ensure that normal services continue uninterrupted, and also lessons learned from Ebola outbreak of 2014. We have directed the 47 counties to identify and designate a COVID-19 hospital so that other hospitals can be allowed to continue offering the normal services, immunization, maternal child health, TB services, HIV services. On top of that, of course, as Waziri has said, we are also in constant dialogue with the security apparatus to ensure that even at the county level, there is unfettered movement of those who require to seek services at any given time. And we have even gone ahead, especially for people with chronic illnesses who require to come to like Nairobi for chemotherapy or radiotherapy. My office has facilitated several letters to people who require. And my appeal to the media is that if there's anybody who requires support in terms of a letter to be able to access services like radiotherapy, chemotherapy, please pass that information. Our offices are open. We'll be able to facilitate them with the necessary correspondence to allow them move and get services. I also wanted to discuss something about the issue of masks. One, is important that before you don on your mask, you wash your hands properly and hold the mask like the one I'm having with the ears, put it on, pinch the nose so that it fits well. It should cover your nose and your mouth. And of course, after use, which should not be more than 12 hours, you should discard it properly. Don't just throw it anywhere. Throw it into the trash can so that it can be properly disposed by the municipal waste management services. I also wanted to bring the issue of the use of gloves. Very many facilities, you find people wearing gloves. And I can even see in this gathering, people who are wearing disposable gloves. Research has not shown any advantage of wearing gloves in terms of protection against COVID-19 infection unless you are using it in a healthcare facility. Remember, gloves are supposed to be used for a particular purpose and then be discarded. People are wearing gloves from morning to evening, they are sweating, the gloves have holes, and that breeds a lot of complacency. Therefore, they forget to wash their hands. Please avoid wearing gloves unless you are a healthcare worker. And if you are to use gloves, use them and immediately you finish using them, please dispose of them appropriately. Otherwise, the other danger that you are exposed to when you wear gloves for too long is that involuntarily you are bound to touch your face. And because if you wear it for too long, then it could be contaminated. The moment you touch your face, that puts you at a risk of getting the COVID-19 disease. The results, isolation and quarantine facilities, of course, isolation facilities are manned by medical practitioners. They are doctors, they are clinical officers, they are nurses. And once we collate and compile the results for the day, we transmit them to the facilities, either the isolation facilities and the quarantine facilities. We have designated senior officers. In fact, heads of directorates in the ministry are the ones who are responsible for the quarantine facilities, and they are the people who are supposed to transmit the results to the people in quarantine. The people in isolation, of course, get their results from the clinicians who are taking care of them. There were problems before because sometimes of transmission. Remember, the results are coded, and initially we were using a manual system. Now we have gone digital. That could lead to a bit of delay, but from yesterday, things have really improved. And as Waziri has said, we are closing the quarantine facilities. In fact, we are doing testings from day 8 to day 10, the second testing, and if you turn negative, then we send you to continue self-quarantine at home, even at the county level in consultation with the county health management teams. So we are looking, today the team is out to visit the remaining quarantine facilities like MTC, Nairobi, MTC Karen, the Panaris, Lantana in Westlands, and we are comfortable that by the end of this week, we shall have literally closed all the quarantine facilities. Those who test positive, of course, will have to go to the isolation centers for treatment and monitoring. We are also in discussion with the government of Japan, who have developed an antiviral, Avigan, which you guys might be aware of, which has shown very good promises, so that you can also be able to get some limited doses that our clinicians can also be able to try for COVID-19. And we are hopeful that we'll also get stellar results like what they got from Japan and also China. Thank you.